This video is going to be on hemostasis, which is the process by which blood clots form at the sites of vascular injury. So I've already drawn a blood vessel that is lined by red endothelial cells, and I'll abbreviate that with an EC. And those endothelial cells are lined by subendothelial collagen, and those are the pink strands below the endothelial cells. Within that subendothelial collagen is a lot of different proteins, and the ones that we care about with hemostasis are tissue factor and von Willebrand factor. So I'm going to draw von Willebrand factor as little pentagons within the subendothelial collagen, and I'm going to label that with a VWF, and that's the abbreviation for von Willebrand factor. There's also lots of tissue factor, and I'll draw those as little gray circles, and then abbreviate that TF for tissue factor. So when the blood vessels are injured, there is loss or death of those endothelial cells, and that leads to exposure of the subendothelial collagen and release of lots of vasoactive substances from the injured endothelial cells. Those vasoactive substances first lead to vasoconstriction. So the blood vessel constricts, and it does so to reduce the amount of blood that goes to the site of vascular injury. So thereby it reduces the amount of hemorrhage at the site. But that effect is only transient, it's not long-term. So some other process has to go on to stop bleeding at the site of vascular injury. And that's where our platelets come in. So platelets are anucleate cells in blood that are circulating that have a very important role in hemostasis. They have surface markers for von Willebrand factor. So when the von Willebrand factor is exposed, the platelets then bind to that subendothelial collagen and form what we call a platelet plug. And that platelet plug is what we call primary hemostasis. Now this platelet plug isn't very strong, so secondary hemostasis then occurs to help solidify that platelet plug and make it become stronger. Now remember that tissue factor that I said was within the subendothelial collagen. When it becomes exposed to the blood circulation, it then leads to a cascade of events that leads to cleavage of coagulation factors, which is known as the coagulation cascade. So tissue factor results in activation of coagulation factors, which result in activation of other coagulation factors, which results in activation of other coagulation factors, and so on, until the end result is cleavage of fibrinogen, which is a soluble protein, to fibrin, which is an insoluble protein. And this fibrin has receptors for platelets. So it acts as platelet bridges that bind adjacent platelets and form a strong network that solidifies that platelet plug. So this cascade of events that ultimately results in fibrin formation is called secondary hemostasis. After the blood clot has formed, then the clot has to dissolve or undergo lysis so that blood flow can return to normal in the area. And it does that by a process we call fibrinolysis. And I'm going to stop there with fibrinolysis. You'll learn more about that in other lectures. But for right now, just realize that there is a process for repairing that site of vascular injury and dissolving the platelet plug.